The significance of Juneteenth, an examination of independence and freedom in America. In the annals of American history, two dates stand as prominent symbols of freedom and independence, July 4th and Juneteenth. While July 4th commemorates the nation's Declaration of Independence, Juneteenth holds equal historical weight, representing the emancipation of enslaved African Americans. Both dates reflect the complex tapestry of America's journey toward justice and equality. However, examining the historical context surrounding these dates reveals a stark disparity in lived experiences, exclusionary tactics, and systemic injustices faced by African Americans. This article explores the importance of Juneteenth as a profound and transformative event, shedding light on the intertwined legacies of July 4th and Juneteenth. The historical context. July 4th, 1776, witnessed the birth of a new nation. As the United States declared its independence from British rule, it proclaimed the ideals of liberty, equality, and the pursuit of happiness for all its citizens. However, as Frederick Douglass eloquently pointed out in his speech, what to the slave is the 4th of July? In 1852, these principles rang hollow for the millions of enslaved African Americans. Douglass passionately condemned the hypocrisy of celebrating freedom, while African Americans remained in bondage, oppressed by the institution of slavery. It wasn't until June 19, 1865, Juneteenth, that enslaved African Americans in Texas learned of their emancipation, more than 2 years after the Emancipation Proclamation had been issued. General Gordon Granger's arrival in Galveston, Texas, brought the news of liberation, marking a transformative moment in American history. Juneteenth symbolizes the resilience, struggle, and ultimate triumph of African Americans, highlighting the ongoing fight for equality and the recognition of their humanity. Exclusionary tactics and systemic injustices. Segregation, a defining feature of American history, entrenched the marginalization of African Americans and perpetuated disparities in all aspects of life, including health care. The legacies of segregation are etched deeply in the collective memory of African Americans. A black national anthem? The idea of a black national anthem is rooted in the historical experiences of African Americans in the United States. The notion of a black national anthem reflects a desire to celebrate and affirm the experiences, contributions, and cultural heritage of African Americans within the broader national narrative. It serves as a way to acknowledge and honor the distinct struggles and achievements of Black Americans, while also promoting inclusivity and diversity within the fabric of a nation. Throughout history, African Americans have faced systemic racism, discrimination, and marginalization, often excluded from mainstream narratives and symbols of national identity. The Black national identity. The Black national anthem serves as a powerful symbol of resilience, strength, and cultural heritage. The Henrietta Lacks case and the Tuskegee experiments are grim reminders of the medical community's exploitation and disregard for the rights and well-being of African Americans. These incidents, among others, created deep-seated mistrust and skepticism toward the healthcare system, fueling a sense of exclusion and further exacerbating health disparities. The Tuskegee experiments, conducted between 1932 and 1972, involved withholding treatment for syphilis from African American men, leading to unnecessary suffering and death. The case of Henrietta Lacks, whose cells were taken without her consent, epitomizes the long history of medical exploitation and the disregard for African American lives. These injustices, coupled with limited access to health care and racial biases within the system, have perpetuated a cycle of mistrust and reluctance among African Americans to seek medical care. Henrietta Lacks was an African American woman whose cells were taken without her knowledge or consent and became one of the most important tools in medical research. Born on August 1, 1920 in Roanoke, Virginia, Henrietta Lacks was a wife, mother, and tobacco farmer. In 1951, Lacks sought medical attention for abnormal bleeding and was diagnosed with cervical cancer at Johns Hopkins Hospital in Baltimore, Maryland. During her treatment, without her informed consent, a small sample of her cancerous tissue was taken for research purposes. These cells, known as HeLa cells, became the first human cells to be successfully cultured and replicated outside the body, leading to significant advancements in medical research. HeLa cells were unique in their ability to multiply rapidly and thrive in laboratory conditions, making them invaluable for scientists studying cell biology, virology, and the development of vaccines, among other areas. These cells played a crucial role in medical breakthroughs such as the development of the polio vaccine and advancements in cancer research. However, the story of Henrietta Lacks and her cells remained largely unknown for many years. The medical community used her cells extensively without her or her family's knowledge or consent. It was not until the 1970s, when a journalist named Rebecca Skloot started investigating and writing about the story, that Henrietta Lacks and her contributions to medical science gained widespread recognition. The story of Henrietta Lacks raises important ethical questions regarding patient consent, privacy, and the commercialization of human biological materials. It also highlights the historical exploitation and mistreatment of African Americans within the medical field. Henrietta Lacks passed away on October 4, 1951, at the age of 31, leaving behind 5 children. Her legacy lives on through the continued use of HeLa cells in scientific research and the recognition of the need for ethical standards in medical research, including informed consent and respect for patients' rights. The story of Henrietta Lacks serves as a powerful reminder of the importance of recognizing and respecting the contributions of individuals, particularly marginalized communities, to scientific advancements. Tuskegee Study. The Tuskegee Experiments, also known as the Tuskegee Study of untreated syphilis in the Negro male, were a notorious and unethical medical study conducted by the United States Public Health Service, USPHS, from 1932 until 1972. The study aimed to observe the natural progression of untreated syphilis in African American men, withholding necessary treatment and deceiving the participants about the true nature of the study. The study was conducted in Tuskegee, Alabama, and initially involved 600 African American men, 399 of whom had syphilis, while the remaining 201 served as a control group. The participants were predominantly poor sharecroppers who were not informed that they had syphilis but were told they were receiving free health care for bad blood. The USPHS, along with collaborating institutions, misled the participants by denying them access to proper treatment even after penicillin became the recommended treatment for syphilis in the 1940s. The men were left untreated and were instead given placebos and ineffective treatments. The study continued for 4 decades despite the knowledge that penicillin could cure syphilis and prevent further complication. The Tuskegee experiments had severe consequences for the participants and their families. Many of the men suffered from debilitating health issues and passed the disease to their partners and children unknowingly. The study violated fundamental ethical principles, such as informed consent and the obligation to provide proper medical care to participants. The unethical nature of the study came to public attention in 1972, when an investigative report by journalist Jean Heller exposed the experiment's details. This led to public outrage, congressional hearings, and eventually the creation of stricter ethical guidelines for medical research involving human subjects. The Tuskegee experiments represent a dark chapter in the history of medical research, highlighting the systemic racism and unethical practices that have disadvantaged and harmed marginalized communities. The legacy of this study has contributed to the deep mistrust and skepticism among African Americans towards the healthcare system, emphasizing the importance of respecting the rights and well-being of all individuals in medical research and practice. It is crucial to confront these historical injustices and systemic biases, working towards building a healthcare system that is inclusive, equitable, and trustworthy. Juneteenth serves as a critical reminder of the struggles and achievements of African Americans in their pursuit of freedom, justice, and equal rights. It represents a counter-narrative to the traditional Independence Day celebration, challenging the exclusionary rhetoric that has marginalized African Americans throughout history. By acknowledging Juneteenth alongside July 4th, we honor the complete story of America, a story of both progress and lingering inequalities. Recognizing the historical context of July 4th and Juneteenth allows us to grasp the full spectrum of America's journey toward freedom and justice. While July 4th represents the ideals of the nation's founding, Juneteenth is equally significant, symbolizing the end of slavery and the ongoing struggle for equality. The exclusionary tactics of segregation, the Henry Case, the Tuskegee experiments, and the persisting disparities in healthcare access have contributed to the deep-rooted mistrust that many African Americans harbor toward the healthcare system. The legacy of Juneteenth reminds us of the imperative to address the ongoing challenges faced by African Americans. It calls for the dismantling of systemic barriers that perpetuate health disparities and hinder access to quality healthcare. Efforts must be made to ensure equitable healthcare access, eliminate racial biases within medical institutions, and actively involve African Americans in decision-making processes that affect their health and well-being. Recognizing Juneteenth as a national holiday was an important step towards acknowledging the significance of this day in American history. It signifies a commitment to grappling with the complex and painful truths of the past and working towards a more inclusive and just future. By honoring Juneteenth alongside July 4th, we acknowledge that the struggle for freedom, equality, and justice is ongoing, and that the story of America is incomplete without the contributions and experiences of African Americans. As we commemorate Juneteenth and reflect on the historical injustices faced by African Americans, it is crucial to recognize the ongoing impact of exclusionary tactics that have perpetuated health disparities. To address these issues and dismantle systemic barriers, we can take several important steps. Education and awareness. Increase awareness and understanding of the historical injustices faced by African Americans, including the legacy of slavery, segregation, and discriminatory practices. Promote education about African American history and contributions to society, ensuring that these narratives are accurately and inclusively represented in schools, universities, and public discourse. Addressing health disparities. Acknowledge and address the persistent health disparities that disproportionately affect African Americans. Invest in research to understand the root causes of these disparities, including social determinants of health, systemic racism, and unequal access to quality health care. Develop targeted interventions to eliminate these disparities and promote equitable health outcomes. Culturally competent healthcare. Implement cultural competence training for healthcare providers to ensure they understand the unique needs, experiences, and challenges faced by African American patients. Foster an environment of trust, respect, and sensitivity in healthcare settings, ensuring that individuals are treated with dignity and receive equitable care regardless of their race or ethnicity. Community engagement and empowerment. Engage with African American communities and empower them to actively participate in decision-making processes related to healthcare. Involve community leaders, organizations, and individuals in shaping policies, programs, and initiatives aimed at improving health outcomes. Promote community-based healthcare models that prioritize local needs and ensure access to comprehensive, culturally appropriate care. Policy and advocacy. Advocate for policies that address systemic barriers and promote health equity. Support legislation that expands access to quality health care, reduces racial disparities, and addresses social determinants of health. Engage in advocacy efforts to eliminate discriminatory practices and promote inclusivity in healthcare systems and institutions. Collaboration and partnerships. Foster collaboration between healthcare providers, researchers, community organizations, and policymakers to develop comprehensive strategies for eliminating health disparities and promoting health equity. By working together, sharing knowledge, and leveraging resources, we can create meaningful change and dismantle systemic barriers that perpetuate health inequities. Commemorating Juneteenth provides an opportunity for collective reflection, learning, and action. By acknowledging the historical injustices faced by African Americans, examining the root causes of health disparities, and actively working towards dismantling systemic barriers, we can foster a more equitable and inclusive healthcare system that ensures the well-being and dignity of all individuals, regardless of their race or ethnicity. In the words of Frederick Douglass, "What to the American slave is your 4th of July?" The answer is a day that reveals to him, more than all other days in the year, the gross injustice and cruelty to which he is the constant victim. Juneteenth offers an opportunity to confront that injustice, acknowledge the resilience of African Americans, and work towards a future where every individual, regardless of their race, can enjoy true freedom and equal access to health and well-being.